Hi, this is Dr. Tom at Causenta, and today's technology is called Hippotherapy. Essentially, this is a machine that mimics riding a horse, and what's really cool about it is we could actually increase the intensity. And so we would use this type of machine with someone that has any type of neurological damage or just challenges with balance. So for example, someone that's had a head injury, could be an athlete, someone that's got issues, like a person with spinal cord injury, even people with Parkinson's, anyone that when we assess them, if they have difficulty with their balance, it doesn't matter if it's something like from a disease like cancer, or if it's an athlete that's just losing their coordination from maybe too many hits to the head, or someone from the military that was, there was an explosion nearby and they've got some post-concussive syndrome. And the way the technology works is like this. So someone sits on it, they try to pull their heels back so they're kind of like in line with their hips and their shoulders. The arms relax, hanging at the side. When we turn it on, the goal of the person using the machine is to try to stay upright without being knocked over. So we're going to start it at a very easy level, so this would be like the beginning level, and it can get much more intense, but for the purpose of the video, what I just want you to see is how the person has to balance themselves while they're sitting on a hippotherapy device. The reason why this is so cool is it actually helps the brain to engage all the muscles around the core. And what's nice is no drugs, there's nothing invasive, so you could do this, for a pretty long time. And most people find it actually, when they first do it, they're like, wow, I could really feel a difference. I actually just did this today on someone, and we tested them first to look at their balance. We then did this one time, and immediately after we retested their balance, and it was significant improvement. And then from here, what we do is go to more progressively challenging levels. We could do other things with moving them to a vibration platform at a later date. But now what you're probably wondering is like, why have these cables hanging in the background? What I could do with someone that has spinal cord injury or say a head injury where there's maybe a lot of dysfunction with stabilizing their upper body, we could hook these cables up over the top of the rack. I could put a harness on them, and I could use these carabiners to connect to the harness on the side. So that way, even though they can't stabilize their body, if they fall to the side, the cable will actually prevent them from falling off. So it puts them in a safe environment, but also allows them to really try hard to work their core. So another great technology we have at Causenta. If you would like to get access to it or see how it goes, just go to our website, causenta.com. Just right at the home page is a form you could fill out and request an opportunity to see it. Or if you can't wait, just give us a call at 480-883-7240. This is Dr. Tom signing off again, and I look forward to meeting you. So I'm asked all the time by patients, what's the difference between personalized medicine and traditional medicine? And in traditional medicine, there's a singular approach. So you have cancer A, and for cancer A, here is the standard of care treatment. And after you go through the standard of care treatment and it doesn't work, typically there's not a plan B, there's not another option. So then patients are told, hey, there's nothing else that can be done. And so then they're convinced that, hey, there's no hope and we can't do anything else. Now I want to contrast that in a personalized approach that we have at Causenta. We're going to measure all kinds of details within your body. And we're going to find lots of areas that we can actually improve your health. And then indirectly, by improving those areas, we're going to help you do a better job at fighting cancer. So whereas someone else would say, hey, there's nothing that could be done, we're going to say, hey, there's lots of opportunity here to improve your health and make sure that you have a better quality of life so that you're able to function and live life under your own terms and not just waste away in a bed in hospice somewhere and watch everything go by you as time passes on. So if you or a loved one has been diagnosed with cancer and you're looking to get help, I strongly encourage you to go to causenta.com and fill out the form at the bottom of the page and find out for yourself how we can help you.